Okay, there's my audience members. And here is my video. This is the only way I can do it. Okay. Ready? Hello, ladies and gentlemen. Today we'll be discussing the importance of infection control in long-term care facilities to prevent the spread of nosocomial infections, also known as HAIs, or hospital-acquired infections. I realize that this particular subject has been beat into your heads over and over. However, I cannot stress how vital it really is to keep our fragile residents from becoming further deconditioned. We as healthcare workers are responsible for the health and welfare of our residents. Most of you may not realize how prevalent HAIs are in healthcare. According to the CDC's website, HAIs, or healthcare acquired infections, affected 721,800 hospitalized patients in 2011, which are the most current statistics available at this time. As we all know, HAIs mostly affect elderly patients and those with impaired immune systems. This is due to the patient's inability to fight off infections. The most common types are HAIs are pneumonia, UTIs, or urinary tract infections, and C. difficile. The one we will be discussing today is C. difficile toxin. Being healthcare workers, we all have heard of this dreaded diagnosis of C. diff. But what exactly is it? Clostridium difficile is a bacteria that can cause symptoms ranging from diarrhea to life-threatening inflammation of the colon, also known as pseudomembranous colitis. According to a study in a 262-bed long-term care Veterans Affairs facility in Pittsburgh, Pennsylvania, for a 6-year period, this study revealed that approximately 40% of patients acquired this dreaded infection. In a long-term care setting, that's unacceptable, ladies and gentlemen. We have to do better. Long-term care residents taking certain types of antibiotics for various conditions are extremely susceptible to C. diff. This is because many antibiotics can cause severe diarrhea, which cleans out all bacteria in the GI tract, especially even the good bacteria needed for proper digestion. Signs and symptoms to look for in patients taking an antibiotic like Levaquin are loose, watery stools of more than 3 in an 8-hour shift, fever, nausea, and general malaise. Many types of infections are transmitted on the hands of healthcare personnel. The best way to prevent the spread of infections, especially C. difficile, is through proper hand washing. When patients begin to show signs and symptoms of C. difficile, contact isolation is implemented to prevent further spreading of infection. Contact isolation precautions require healthcare workers to use not only standard precautions, but further implore strict adherence to facility protocols. These protocols are recommended by the CDC to prevent transmission and distress of disease in contact isolation. This means that the resident is isolated from healthy patients. Staff that are to come in contact with the patient site of infection, in this instance their stool, must protect themselves and other residents from acquiring this serious infection. The key to breaking the chain of infection is proper hand washing technique. You start with wetting your hands with warm water. Then you rub your hands together to create friction for at least 15 seconds or to sing the happy birthday song to yourself. Rinse under running water, dry with disposable towel. Throw this towel away. Don't use that one. Then you obtain another dry paper towel and turn off the faucet with this towel and then throw that away. Why is hand washing a vital element to prevent C. diff? Why can't we just use alcohol-based hand sanitizers? Yes, they are more convenient and less drying than hand washing before and after patient contact, but they are in no way effective enough to kill the C. difficile bacteria. When residents acquire C. diff, they require more care, recovery time, and greater cost to the patient and facilities. Not only that, but placing residents in isolation can lead to feelings of sadness and depression. Although frequent hand washing is drying and damaging to the skin, it is the only way to kill C. difficile germs on hands. To minimize these effects, we need to remember to apply facility-approved moisturizing agents frequently to prevent contact dermatitis and cracking of the skin. Now that we have learned about the importance of hand washing to prevent healthcare-acquired infections like C. difficile, let's improve our employee practices with patient care. Since research has shown the actions of clinicians influence the behaviors of others, let's strive for less episodes of healthcare-acquired infections. By showing your colleagues that hand hygiene is an important part of your daily regimen and our infection control policy. Thank you, ladies and gentlemen.